Hello, my name is Peter Chapsky. I'm going to show you how to make an appointment in OSCAR EMR. I've clicked on the schedule page a time slot for the provider named Peter Chapsky, and that provider shows up here as make appointment for. It actually happens to be double booking at 8:30 in the morning. That's the time is designated in the analog clock as well as the digital one down here. You can change the appointment date and time from that which was picked by selecting the time slot by merely clicking the data entry areas. For example, here we have June 6th, which is fine. Start time we can change to some other start time if we want. 8:15. And there we go. Duration is as per provider norm, 15. And can, of course, be altered as you like, either through the scroll or by direct entry. Now we have to pick the demographic that fits into this appointment slot. We can use the standard OSCAR search window by clicking the search. However, in this window, we can be a little bit more creative and just use this particular spot here where it says enter swipe demographic. Because you can enter swipe demographic, sure, you can swipe the patient's OHIP card and the insurance number will be abstracted from that and will be sent for a search. Or if you know it, you can enter it. So let's search for that particular health number. And if there's only one search finding, then the search window will close automatically and will populate this form with the correct patient, the correct doctor, and so on. So this works with health insurance number, but you're not likely to be actually using that unless you're swiping the card. You could be using the patient's birth date. You could be using the patient's address to search with. Again, enter those into this box, hit the search button, and that particular type of search will occur outside of this window. But most of the time, you don't want to bother with all that. You want to do it much quicker than that. In fact, you know the patient's name, because that's what the patient has identified themselves with. So you can enter it here. And when you do, it will be an autocomplete that will form, and you'll have the patient's name, the patient's birth date to help identify them, whether they're an active patient or not for the practice, and their designated most responsible physician. So let's pick this one. And so with picking that one, you have the patient's demographic number filled on the form, 8217. The patient's doctor is MRP, filled in the form. And now we can move on to reason. So this one's kind of boring. You just pick one. Let's say skin. Let's say there's a rash. That's why they want to see. The location defaults to the most common one. In this case, the Hailberry Family Health Team. Let's say we're going to do this in a surgery clinic instead. Creator is me. That's the person to open the form. Status to do. Well, let's pick customized one. So you can see that both the status and location are color-coded. The type is a macro. The type will overwrite your duration. We'll add to the reason. We'll add some notes and resources. And if you are multi-site enabled, as we're demonstrating here, it will also change location to the appropriate one designated by the type macro. So let's say we're going to do inpatients. So here we go. Inpatient is prepended to the reason here. The location is Temiskaming Hospital. The time has been changed from the default of 15, or the manual override it to 20, to the current 30. Now you can override it back to 20 if you want. That's entirely appropriate. But the macro will set whatever time frame you have set in the macro for most cases. Notes and resources we don't use very often. But however, let's say you have a skin biopsy, which you might have for a rash. You might have requirements for a given room. for a tray, maybe some personnel, a nurse to help. These things can be designated in notes and resources associated with that particular type. Date and time is when you open the form. Critical, if you use this checkbox, it will put a exclamation mark on the patient's appointment on the schedule screen, so the staff will know that it's a critical one, and if the patient doesn't show, or if the patient cancels, that it will be extremely important to rebook this appointment. The most common function that we use, of course, is, as per OSCAR defaults, color-coded blue. So add appointment is the most common function that we use from here. Group appointment, sometimes we do when we have two people seeing the same patient, often at the same time or same day. You can also, of course, print the appointment in many different formats. For example, a appointment card. R is for recurring appointments. That certainly will happen with inpatients, that you'll be seeing them daily until they've been discharged. And of course, you can cancel. This is, of course, how the form looks on a laptop, desktop, and on the landscape settings of most mobile devices. It isn't how it looks with regards to a mobile device that has a portrait setting that has a small screen. Let's investigate that. So this is how this particular form looks on a Galaxy Note. You can see that each and every function is available as before. It's just formatted in a way that is more appropriate for your particular device. That's all I'm going to show you. Thank you very much. I'm just going to cancel. Bye.